to pillar 4. Now, this pillar doesn't need a lot of explaining because it's a no-brainer. This is the clinical digital practice and informatics. So we've covered infrastructure, the data, and the strategy. Now we learn where it matters the most. The bedside. 100 years ago, a stethoscope was a radical tool. Doctors could hear the inside of the body. It was transformational. But in our day, our new revolutionary tool is technology. It is digital. It is the tablet in your hand, the monitor by the bedside, the video call of your patients, and it feels clumsy sometimes when things don't go wrong, or it feels too much, or it feels like extra work. Now, this is what I'm going to explain in this pillar: how technology and clinical practice can marry together to create a powerful process to deliver better and brilliant care. Now, I'm going to introduce you to the toolkit analogy. Now, first, we have the electronic patient record. So this is the digital notebook. It's a single source of truth of a patient's story. So it's almost like a record of the information of every patient, everything you need to see, their dates, their names, their date of birth, all of that. That is in your toolbox. That's in your digital toolbox. Then we have e-prescribing. So this is a smart safety check dispenser so that you dispense drugs and medications safely and precisely, so that you don't give the wrong medication to the wrong person and is given in the correct dose. Remember, put that one in your toolkit. Now, we also have telemedicine and remote monitoring. So this is the long distance stethoscope. So your doctor doesn't need to be there in the room with you, or you don't even need to be in your GP presently. You can do video calls and discuss your symptoms. We have devices these days that you can wear that your doctor can monitor all the way in the office. Now, those three, there are other tools, but these are three main tools that is in every digital tool kit. Now, the learning point I want you to take away is this pillar is not about IT support. It is clinical practice in digital age. So in digital age, these three things you can not do without it and call yourself a digitally led trust or hospital. You need these three things and other things as well, but these are the three top ones. Now, in terms of career, in this pillar, you have clinical informatics, health informatics, the non-clinical part, and digital health technology delivery. So now these roles are the roles that are purely health informatic or informatic related, and they don't include the core clinical roles like your doctor, your nurse, your HCA. These are alternatives. So if you've been a clinician for a long time and you're looking to transition into something data related, these are the roles you should consider. Or if you're not even in clinical space as well, but you want to be just a little bit close, these are the roles you can consider as well. Now, let me explain the guiding science of health informatics. So as the definition goes, health informatics is the interdisciplinary science of designing, implementing, evaluating information systems that improve healthcare outcomes, patient care, and strengthen the clinician-patient relationship. So again, let's use analogies. So if clinical digital practice is using the toolkit proficiently, health informatics is the human-centered engineering science that designs and optimizes this toolkit. So the key domains of informatics, using the example of an electronic observation app, it has to be usable in every condition. So example, at the touch point allows enough for glove hands. So if you're wearing gloves, can you use it? The color coding, is it red for priority? Because everybody knows that red is priority, not pink for priority, because pink is pretty. Now, workflow integration. Does the software follow the natural sequence of a nurse's assessment? So let's say the nurse's assessment starts at A&E and ends in the maternity ward. But if the electronic observation or the app or whatever system it is does not follow that natural sequence that a nurse uses, it has failed. Third is data standardization. Is blood pressure defined and recorded consistently across all systems? Now, this particular domain links back to the data, labeling the data correctly so that we can interpret it better. So whenever any system is built, make sure the information that goes in, or if it's a job you're doing, make sure the data point is recorded consistently across all platforms. If not, it's going to be hard to interpret. Next, we have clinical safety. In all things, do no harm. Everything needs to be safe because this is human lives we're dealing with. Can the design induce error? So, two similarly named medications appearing next to each other in a drop-down list. So it's little things like that that digital health helps improve. And if you're looking to get into this industry, you need to consider all of this in mind if you're either building the app or implementing the app or using the app. Is the app usable? Is the workflow right according to how the people that are using the system do the work? Data standardization. Is everything recorded consistently across all platforms? And finally, is it safe? Are processes done safely? Are things named safely? In conclusion, to achieve digital mastery, there are 3 pillars. You need to critique with an informatic eye. Analytically ask, why does this tool feel clunky? And articulate the specific improvements. So you can say things like, oh, the drop down is too long. I have to keep scrolling before I find any medication. Always critique things with an informatic eye. 2, adapt clinical methods. So proactively involve assessments and communications for digital virtual settings. We're already in the digital age. So you need to make sure that the process and the data that your clinical methods. So whatever process that is used in the hospital or is used in the trust or is used in that environment has to evolve with digital. We're in the digital age, we're not moving towards data, we're already here. So we need to start adapting our processes around the clinical methods that we do. And third, demand human-centered design. So advocate for tools that serve the workflow. So you need to stop asking questions like, what can you do? But questions like, how does this help my care to the patient, or how does this help the patient? That is the crux of clinical digital practice and informatics. So watch this video again, and I didn't really go into much detail because clinical health is no-brainer. It's just being a clinician in the digital health world and other alternatives you can get into. So thank you for watching, and keep getting educated and stay educated. I'll see you in the last video. Well done for getting to this stage.